Social anxiety and avoidant personality disorder can look almost identical from the outside. In both, there's avoidance, fear of judgment, and a painful sensitivity to how others see you. And because of these similarities, people can feel confused about which one explains what they're actually going through. So in this video, I'm going to break down what social anxiety and avoidant personality disorder are, the differences between them, why you might actually have both, and how you can see whether aspects of either one may be driving the pain that you've been living with. To start off, let's talk about social anxiety. At its core, social anxiety is a fear of being judged. People with it tend to worry about being evaluated, embarrassed, or rejected by other people. It's a lot more than just shyness. It's an intense fear that can limit people personally, professionally, and quietly impact your life in very significant ways. But while it can be crippling at times, the fear involved in social anxiety usually revolves around specific social situations, rather than being a reflection of how we see ourselves. For instance, a person with social anxiety might feel comfortable around close friends or family, but become overwhelmed in situations where judgment might occur, like introducing themselves to strangers, participating in class, etc. In these kinds of moments, their mental illness is being fueled by how threatening they perceive their social situations are, not how they see themselves. Avoidant personality disorder, in this regard, is different from social anxiety. While there is a fear of judgment involved in it, avoidant personality disorder is less about the social situations people are in and more about self-perception. Because avoidant personality disorder is a personality disorder, it is a way of thinking, feeling, and behaving in a way that disrupts many areas of life. Therefore, having avoidant personality disorder isn't necessarily about feeling anxious in certain moments. It's about carrying a persistent belief that who you are is somehow inadequate, unlikable, or destined to be rejected if fully seen. Because of this, people with avoidant personality disorder often experience many of the same things someone with social anxiety does. The difference is that with avoidant personality disorder, these experiences are tied to deeper identity beliefs that shape how someone sees themselves across nearly every area of life. As a result, the symptoms tend to be more pervasive and more persistent than what we typically see with social anxiety. So now that we've briefly gone over what social anxiety and avoidant personality disorder are, let's talk about the underlying differences between them. The first difference between social anxiety and avoidant personality disorder is the scope of avoidance. In social anxiety, avoidance usually happens in specific situations, like skipping a party because you don't know anyone there, or steering clear of public speaking events. With avoidant personality disorder, avoidance is a much broader, more holistic concept, affecting almost every social, work, and intimate interaction. Instead of simply feeling anxious during a social event, their entire lives feel like they are backing away from the concept of showing who they are with the world entirely. It's kind of like living behind a glass wall. You can see the world and want to participate in it, but you're constantly holding yourself back, constraining your authentic self in the process. The second key difference between the two is the relationship fear and avoidance has with the patient's self-image. In social anxiety, anxiety is undesired by the patient. It feels uncomfortable for them, prompting them to change who they are on an internal level. This idea means that social anxiety is an ego-dystonic illness, meaning it goes against the internal desires of the patient. Avoidant personality disorder operates in a different manner. Unlike social anxiety, avoidant personality disorder is ego-syntonic, meaning the behaviors and thought patterns of the illness are accepted into the identity of the patient. This means people tend to see their avoidance and self-doubt as just who they are, rather than something separate from them that they might want to change. People with avoidant personality disorder often accept and rationalize the negative behaviors and beliefs they have, thinking things like, if I show who I authentically am to other people, I will be rejected. Because of these accepted modes of thinking, the avoidance they feel internally becomes automatic, making recovery feel all the more difficult. And lastly, the final key difference between both illnesses is the prevalence of their symptoms. Avoidant personality disorder tends to be chronic, affecting people since their early adulthood and deeply linking itself to personality traits and temperament. It is far rarer than social anxiety, comprising only 1.5% of the US population. Social anxiety, on the other hand, is more common and fluctuates over time, easing itself with experience, therapy, or changes in environment. It is approximately 7% of the US population and tends to dilute with age and experience. Given these differences, the next rational step for you is to determine which disorder you might have. A quick note for this video is that this guide is for educational purposes only and isn't a substitute for a professional diagnosis. If you're unsure or concerned about whether you have avoidant personality disorder, social anxiety, or both, it's important to consult a licensed clinical psychologist or clinician. With that said, here are some things to look out for to see which disorder you might suffer from. If you relate mostly to social anxiety, you might notice the following things. You want to connect with others, but nerves, worry, or self-consciousness is holding you back. Your anxiety feels distressing and unwanted, motivating you to overcome it. Avoidance tends to be situational, not affecting all areas of life. You ruminate on social interactions, replaying them in your head afterwards. Self-doubt is mostly linked to social performance, not your overall sense of self. And lastly, fear of negative evaluation is specific to situations, not a constant, pervasive belief about yourself. On the other hand, if you mostly relate to the following, you might qualify for avoidant personality disorder. Your avoidance is pervasive, affecting almost every social, work, and intimate situation. The avoidance itself feels egosyntonic, meaning it aligns with the way that you see yourself and feels like just who you are. You preemptively withdraw from interactions out of fear of criticism, rejection, or embarrassment. Self-criticism and feelings of inferiority are global, not limited to just specific situations. Understanding which patterns resonate with you is one of the first steps toward clarity, and understanding whether it's social anxiety, avoidant personality disorder, or a combination of both can guide you towards the right strategies for growth and recovery. So to recap, social anxiety and avoidant personality disorder share a lot of overlapping features like fear of judgment and avoidance, but they differ in scope, connection to self-image, and how persistent their symptoms are. Social anxiety tends to be situational and ego-dystonic, while avoidant personality disorder is pervasive, ego-syntonic, and deeply tied to identity. It's also possible for you to actually experience both at the same time, which can make these feelings more intense and chronic. If you want to find out the extent of your symptoms, I encourage you to reach out to a professional. Recognizing which patterns resonate with you is a crucial first step. From there, you can begin exploring strategies to reclaim your social confidence, challenge avoidance, and rebuild a sense of self that feels authentic and empowered. If you want to learn more about practical ways to navigate social anxiety and avoidant personality disorder, please make sure to subscribe so you don't miss these future guides and insights. Thanks for watching, everyone, and I'll see you next time.